Hello, my name is Professor Ken Alford. Welcome to our class today. As we enter into week 8 of our program, our focus is going to shift from completing the comprehensive integration health plan model, which is basically a model that uses Bronfenbrenner's theory and combines it into modern day practice into healthcare leadership. We're going to integrate all these readings and put them together as a whole document as we continue to explore how we use this theory to create great leaders. So let's delve into the information. Please look at the learning objectives for this week as we talk about how we can further analyze and apply all the things that we've learned in the past 8 weeks. We're going to analyze Bronfenbrenner's ecological theory and connect it to modern day examples of healthcare leadership. We're going to integrate the previous lessons to discuss leadership impact to the community overall. And then finally, we want to apply the course readings to your own professional and personal growth as a graduate student. Many of you are already leaders, so integrating these concepts into how they make you a better leader definitely will continue your growth, both from learning as a student to moving into novice to expert as you practice as a healthcare leader. We want to look at the readings themselves and see how they make an impact into you understanding how these theories impact healthcare practice. In Bronfenbrenner's ecological theory integration, we looked at a theoretical framework in one of the readings to help us understand how postgraduate students can use health care information, practice, and research to help them become better healthcare leaders. This article is very in depth and it gives pointers to how you are able to be successful as a leader in healthcare using current theory. And another author named Teague talks about how a rehabilitation workforce used this model in Pakistan. And using qualitative studies like working with physiotherapists, they were able to create leadership opportunities for their staff and provide data that supported how those individuals begin to move into those leadership roles. In another article by author, I'm going to try not to mess his name up, Dejusenhin, he talks about how residents and physicians are able to use career planning and development and using these theories that we talked about before to create development-based performance assessment. You know, we talked about that 360 performance that people assessment that people need to have of their skills. Well, this article goes definitely deep and dives into that to see how they were able to apply those articles and move into healthcare leadership roles. And lastly, another article by Azad talks about how individuals were able to uh, manage these theories in the setting of pediatric autism and how the community-based providers were able to use ecological theories to help manage those patients more effectively and becoming superb leaders while doing so. And then lastly, at healthcare solutions, because this is one of the things that we really want to talk about in terms of how individuals are in a healthcare setting are able to work with adults of different groups and support them in their leadership style by using the ecological theory as already mentioned. And then lastly, one of my favorite articles in this group today is about telemedicine and how the telemedicine model, particularly in the mental health strategy, was able to adapt in COVID-19 and taking this ecological theory, make that adaptation from seeing patients face to face and now using a telemedicine platform that healthcare leaders had to quickly adapt in order to survive the isolation, the mandatory isolation. But the reality was that patients still needed the care in order for those physicians to be successful and the patients to have good outcomes. So definitely really good, thought-provoking readings, and it's my expectation that you read these thoroughly and are able to apply these to your clinical settings. Now that you've come prepared to class by completing the readings, you watched the lecture, you've heard the conversations, let's find the agenda timeline for the remainder of the lessons today. After this reading, you'll be asked to go into your assigned breakout rooms within your group. You need to reflect on readings of this week among your breakout groups, and members are assigned a representative to share out in those key takeaways with the class. Once we've gone through all those group share outs, please be prepared to come back to your breakout groups and make connections with your week's reading and real world experience and constructed real world example. And please be prepared to have your group representative to share out with the class. This will be our way of evaluating and assessing and understanding the application. We will at the end of this class begin answering questions and providing you with a look on what to do come next week by reviewing the syllabus together. Now let's get ready to rock and roll. Please wait to take your breakout room number 1.